why are they of concern? So I think what we know is that button batteries have become very common. They're used in a lot of appliances and they're found in every household now. I think the risk regarding ingestion or insertion into orifices of children is generally unknown by the public. There's potential for serious morbidity, and now there's significant numbers of mortality associated with button batteries now reported in Australia, the US, UK, Europe. So the time from ingestion to insertion is critical, and we're going to talk about that. And I think one of the problems with children is there's potential for unwitnessed events, and the symptoms that they have are very non-specific, which means the diagnosis is often missed or delayed, which means that the time critical bit about getting out becomes really important. So what's the anatomy of a button battery? So as you saw on that lateral neck x-ray from my patient, is that they have a slightly tapered profile, and the negative terminal, which is the narrower terminal, is the one where they think most of the injury occurs. So where the button battery faces, and it's normally flat in the esophagus, so it's normally either facing the trachea or facing posteriorly. On our patient, we had the negatives both facing out, so unfortunately they had a double whammy. It should have been the other way around, and that would have probably been better. So obviously there's different forms and different sizes, and this was something I actually learnt when I did preparing the talk in the weekend, is that the numbering is, the first letter is what kind of battery it is, so C is the lithium batteries, R means it's round, and apparently you can get ones that aren't round. The 20, or the next two letters, are the diameter. So the one that we had was 20, which was 20 millimetres, and the next numbers are the height. So it's 3.2 millimetres is the 32. So that's, so you know, I didn't know that until I. So as Emma's talked about, it used to be thought that the batteries leaked, and it was actually acid from the battery that caused the problem. And now we know from the research that's been done by the group in America is it's actually a hydrolysis reaction. So the battery turns water in the tissues into sodium hydroxide, and that creates a liquefactive necrosis. So it's an alkaline burn. And remember, the anode side, if you remember, it's the narrower side, and it's the negative pole, and it causes necrosis. So they've measured that the pH starts to increase within 30 seconds of touching the tissue. So they've measured that in vitro. The really interesting thing, which I heard about when I talked to the people that had done this research when I was on sabbatical, is that histologically they've shown is that the ulceration that you can see on the mucosa is actually very small compared to what the injury that occurs deep to that plane. So it goes into the fascial and muscle planes and then spreads really quickly into those tissue planes deep to that. So what you see on the surface is really the tip of the iceberg, and I think that's quite problematic when you look at the injury and when you're doing surgery or resection later on, which James, I'm sure, would be able to talk in detail about. So what's dangerous, the higher voltage is more dangerous, but also the bigger ones, and I think probably a bit like the coins, is they're more likely to get stuck and cause spasm at cricopharyngeus and get stuck if they're bigger. So smaller are more likely to pass through without getting impacted. And obviously more than one battery at a time is worse. So the first death, and in fact the first reported injury, was in 1977, and the patient died from ingestion of a battery. The location is important, and although there are other places that are bad, the upper esophagus is the key place that causes life-threatening injuries. As we talked about, time is of an essence. The type of battery being bigger, patient factors, a patient that's non-verbal, so obviously they're less likely to be clear if it wasn't witnessed what might have happened. An older child might be able to say that they swallowed it. Symptoms, as we said, are non-specific, and that's really makes it very, very challenging. The children can present with very non-specific symptoms. Ulceration can occur in 2 or more hours, and perforation in 5 or more hours. So what are they coming from, these batteries? Watches, toys, hearing aids, obviously lots of things, and that will become more and more common. And as batteries get taken out, when they run out and get replaced, they may be left lying with other small things that the children can pick up. Age-wise, as you can see, this is generally in the younger age group, preschoolers, but it can be, there have been batteries swallowed in older people as well. So where is it identified? So obviously it passes through the stomach and is less concern when it goes distally, but they can put them in their noses, they can put them in their ears, and certainly if they become wet, even in the ear, they can cause problems. So I just thought I'd mention briefly about nasal button batteries because, again, children stick all sorts of things up their noses and it's not necessarily an emergency to get it out, but certainly with button batteries it is. They can present with a delayed diagnosis with unilateral nasal discharge. There is a very, very high risk of nasal septal perforation, and then once they have that, it's very, very hard to repair. So there's lifelong complications from that. And interestingly, in the nose, thickness seems to be more of an issue, and so the chance of perforation is higher if it's a very fat battery. So this is some images that I took from some endoscopy pictures at Starship, and I'm not sure how to play that video. Let's see how we go. So this had been in for 6 hours. You can see the little white line I drew. So that's looking from one side of the nose through a big hole through to the other side of the nose, and that's what the inside of the, I'll just play that, oh no, might not be able to play that again. Certainly badness in the nose as well. One interesting thing worth considering if you don't have a handy ENT surgeon and there's going to be a delay getting them to theatre is that they are magnetic. So there are some instruments that can be used that can actually help pull it out reasonably atraumatically. So looking at button battery cases, this is some Australian data. Certainly the numbers are increasing. There are certainly some that are thought to have possible button battery ingestion that are proven not to have them, so more people are presenting and you're having to sort them out. But certainly it's going to be an increasing problem, I think. This is American data which shows an increasing trend, but also an increasing trend of major or fatal outcomes. So I think the problem is not only getting a bit more common, but also it's getting more serious with the complications. So what are the complications? And obviously the main thing that we're worried about is esophageal perforation and complications from that. It can erode anteriorly into the airway, it can erode laterally and go into blood vessels, and this shows one that's actually eroded posteriorly and is called osteomyelitis of the spine. So there have now been quite a lot of studies with reported deaths, and this is the biggest one here, which was 33 deaths. Over half of them had presented one or more times before they presented at the time they were diagnosed. So it was a misdiagnosis in over half of them. And probably one of the big factors in that is that 92% of the children that died, the event wasn't witnessed. So the diagnosis was delayed because it wasn't easy to think of that as what the problem was. I think it's just something that we have to be aware of. So this is just to the 2 Australian deaths that have happened not too long ago. And she was taken to hospital 3 times before she died, and the diagnosis wasn't made on any of those visits. And this is another one who died in Australia, and she had erosion through the esophagus, and she actually died from aspiration of hemorrhage. I have been involved with the ENT group, Paediatric ENT group in Australia, because they're obviously very concerned about this. In Lady Salento, they had 3 admissions this year already. All of them required PEGs. One of them required a trachea. One of them has a permanent vocal cord palsy related to recurrent laryngeal nerve injury. All of them were taken out reasonably promptly, so within that 4 to 6 hour period, and they still had these severe complications. So this is some photos from one of the cases in Australia, and I'm showing airway complications. So this is a case that many Starship people may be aware of. So this was an 8-month-old who had an unwitnessed ingestion, and probably the battery had been in place in the upper esophagus for 3 or 4 days before it was identified and removed at a peripheral hospital. He came over to Starship, and this was the inside of his trachea, so you can already see it wasn't eroded through, but certainly there was significant damage of posterior tracheal wall of trachealis. He went on to have more than a year in PICU, and he had more than 2 years in hospital. He had multiple surgeries, and I think one of the issues we talked about with the injury extending in those fascial and submucosal planes is that the area that they could see of mucosal injury probably didn't reflect how extensive the injury was in the deep tissues, and the blood supply when they did anastomosis was probably compromised. So the question is, can we do more? So obviously increasing public awareness, pushing for change in industry codes around batteries, pushing for change in battery design. So there's definitely ways that batteries can be designed that will have a much lower risk of causing these injuries. Increasing awareness of early recognition and removal. And the next thing is, if it's in there, what can we do to try and prevent the severity of the injury? So running through those things, there's lots of things that have been done, including the group that James Hamill is involved with, looking at increasing awareness. There are things that have been done, this is in Australia and also quite currently in New Zealand, looking at trying to improve industry codes. There's increasing use of warnings on products that have button batteries. And there are certainly research that's been done in looking at coatings, and certainly zinc air batteries seem to be very minimal regarding the risk compared with lithium batteries. The problem is these batteries are going to be more expensive, and I think these toys and watches and everything, they're going to use the cheapest possible batteries that they can. So this is going to be a long haul. So I think we know about using X-rays to look for them, and you can see the step, the classical step, that it's slightly bigger in one dimension and flatter on the top, and with the one that came to theatre with us having the 2 batteries. So this is kind of where the interesting thing for me came. I was on sabbatical last year, and I was visiting a children's hospital at Philadelphia, and I just happened in a tea room to chat with a student that was doing some research there, and found out she was doing some research on button batteries, which I was really interested in. So talked with her for about an hour and found out about the histology stuff that she's doing and the work that she's doing. And so when the patient came and I was on call and was coming in to help with the case, I quickly Googled and saw what this group had published already on their research, and found out about the using the acetic acid. So being an alkalytic injury, what you're wanting to do is to try and neutralise that. And I think what happens is the battery comes out, but you've got this incredible increase in pH that persists after the battery's removed. So acetic acid is essentially vinegar, and we use 0.25%. So the vinegar that we all have in our cupboards to make dressings is about 5%. So it's quite dilute, but actually what it's doing is neutralising the pH, the injury that's occurring, and helping to stop that propagating and causing that deep injury in the tissues. So these are just some photos that I took at the time of that case. And these are the 2 papers. So this group has gone on to publish 2 papers, and they've done some really interesting work. They've looked at different kinds of batteries and the kind of burns they cause. They've sorted out the pathophysiology of the mechanism of the injury. And then what they obviously looked at the acetic acid and trying to mitigate the severity at the time the button battery's removed. But what they wanted to do is look at what can you do if the poison centre's rung and someone says, little Johnny swallowed a battery, what do I do? And you obviously say, get to the hospital and get it out as soon as we possibly can. But the thing is, what can you do meanwhile? And so what they looked at is what things would people have in their households that the child could take orally that may mitigate the severity of the burn. And what they identified is that honey significantly reduced the severity of the mucosal injury if given orally. So, well, topically in this case, but so what they think is it creates a viscous layer and it actually is preventing the severity of the burn in that tissue. And obviously the other thing that they looked at was sulcrophate, which is something that is available in emergency departments. So while theatre's being mobilised, you certainly don't want them to go via the supermarket and kind of scan the aisles to try and find some honey. But I think if they had honey in the cupboard, that would be the advice you would give. And on arrival, certainly you should start some oral sucralfate. There are concerns about honey in an under 1-year-old, but to be honest, I think if they're going to die because the battery's in there too long, they're probably better to take the risk of botulism and take the honey. And certainly irrigating with acetic acid, and I think potentially the question is whether we should be using it in the nose as well. Certainly I think you should get the battery out of the nose, ideally even before you go to theatre, but I would certainly consider taking them to theatre urgently and irrigating and doing some debriding and putting the vinegar in the nose, because I think anything that stops the severity of it, particularly if it hasn't already perforated. So, can we do more? Yes. Thanks.